Hi everybody, I'm Dr. Steve Alukonis. Today I want to talk about a large part of my practice, and that's the functional medicine practice. Many patients come in from local, but also from far away. They find us for various places, a lot of times from the internet, when they're searching and trying to find out why they are not improving under conventional medicine. A lot of conditions would be thyroid imbalances, underactive thyroid, autoimmune thyroid, and other autoimmune conditions. Autoimmune conditions are an epidemic. Several years ago, there was only 150 of them. Now there's over 300 different types of autoimmune condition affecting your body. What does autoimmune mean? It means when your own immune system wakes up one day and starts going haywire, attacking you, attacking different parts of your body. If it's your thyroid, it's called Hashimoto's. It's going to actually attack and try to kill your thyroid gland. And it's one of the most underdiagnosed thyroid conditions today. Most physicians only test for TSH when they do blood work. TSH and possibly T3. Why? With TSH, if that is out of order, then they can give you Synthroid, a thyroid hormone replacement. However, look at yourself. Ask yourself, are my symptoms any better? Are my symptoms gone since I started taking a hormone replacement? Usually, no. Usually symptoms are still there, you're suffering, and you don't know why. Here's the reason. 90% of the time, your underactive thyroid is coming from your immune system. It actually is called Hashimoto's. How do we know? We test. Test. We run two specific blood tests. There's two autoimmune blood tests that we always run to see if your condition is actually autoimmune thyroid, Hashimoto's. And again, 90% of the time, it's going to show up. And then what do? Now we know what direction to take that patient, to take you or your loved one, and move them in the type of healthcare that will actually help them respond, repair, return, and get optimal health again. But the question is finding out what the real root cause is. That's what functional medicine is. We spend thousands and thousands of hours studying and training and learning how the body actually operates and how to look for root cause problems. That's what this little chart is. I know you can't read each one of these, but I want to read this. We look at all the pieces of the puzzle to find out what's really going on. You come into me and you sit down and you say, Dr. Alukonis, fatigue, Dr. Alukonis, I feel depressed all the time, or anxiety. I can't sleep, Dr. Alukonis. My digestive system is no good. It's just not working right. I have allergies, Dr. Alukonis. I feel like I'm 20 years older than I should be. My hair is falling out. My skin is dry. I just don't know what to do. I've tried this whole bag of vitamins. Look inside. There's a lot of vitamins and supplements, but it does no good. My doctor, he just keeps upping my Synthroid. He thinks maybe that might help. It helps only a tiny bit. I might get a little more energy, but that's it. I need help. That's a typical patient that walks in this door every single day. Now, what makes me different is I always look and I find the root cause. How do I get there? This is what I do. I first evaluate the patient. I'll examine the patient. I'll find out if they have any nodules or goiters in their thyroid. I'll take an extensive history. I'll find out, how long have you had this? How long have you been feeling this way? 15 years. Oh, it was right after you had children. Oh, okay. A lot of times stress can bring it on. And a lot of times it takes time to get to the point of ill health that you're actually at. So most people that are sitting in these chairs in this room have usually been sick over the course of 10, 15, even longer years. Now, Once I evaluate them and give them a physical examination, I check their brain health. I want to see if they're able to touch their nose, see how they walk. I look at their structure of their spine, because in functional medicine, your structure is an important part of care. Why? Because it affects your nervous system. If you're walking around hunched over, okay, you're not getting good breathing, you're not getting good lung capacity. The other thing you're not getting is good circulation. And on top of that, your overall nervous system, that's your master system, is not functioning at 100%. So if we take that person and work with their structure, sometimes by adjusting vertebrae in their spine, that in itself will help them obtain health. The next thing I do is send them home, and they fill out these neuro-metabolic forms, they're called. There's about 240 questions on here. Each one is about a different system in your body. I want to know how your stomach is doing, your digestion is doing, your liver, gallbladder, your stress level, your hormones. I want to know about brain health. I want to know about blood sugar, or if you're turning more into diabetic. I want to know how your adrenal glands are. Those are your glands that kind of keep you running and keep you strong every day. I mean, it just goes on and on and on. So, you either are good, or you have mild, moderate, or severe problems with these. It gives me a tremendous amount of information. So right here, I'm finding out root cause. Sometimes we look for food sensitivities. We run sometimes blood tests, and we might test 200 different foods, because a certain food you might be sensitive to, and it might be keeping you sick. Blood tests, let's talk about that. We do extensive blood tests, not your basic little blood test that most people come in with. That doesn't give me much information. I want to know your vitamin D level, your B12 level. I want to know how your iron is doing. I want to know how your liver is doing, your cholesterol is doing, your good cholesterol. I want to know it all. The other thing we do is we like to test for adrenal function. Your adrenal glands are extremely important to you, especially if you have autoimmune condition or thyroid condition. They're sister glands to your thyroid. There are these walnut glands on top of your kidneys. These two glands give you energy. They put out cortisol that pumps more glucose into your body when you're fighting infections or you're not well. Your body needs more additional energy output, so it tries to put out more cortisol. But if it does it too much and too often, these poor little glands that sit on your kidneys get fatigued. So when you come in, you say, Dr. Alukonis, I'm fatigued, I wake up tired, I'm not sleeping at night. Right here, the adrenals are probably fatigued. So we do a 12-hour saliva adrenal test. You do this at home. The other thing we sometimes do, looking at root causes, I want to know if you have hidden infections. Sometimes you might have the Epstein-Barr virus in your body, or Lyme's disease in your body, or herpes virus in your body. So we like to either muscle test or other tests to determine if you have any of these hidden infections. These are different vials, and I'm not going to get into it on this video. It just shows each vial is testing for something different. It'll help me understand if you have excess yeast in your body or bad bacteria inside your body, especially in your digestive system. I want to know some of your levels of your calcium and your magnesium. So these test kits will help you understand that. The other one I don't want to leave out is we do live blood cell analysis. A little stick, okay, a little prick of blood. We look at it on a microscope right there on a big screen. You'll sit with us and you can see if you have too much yeast or candida in your body, or bad bacteria, or even parasites. World of information. You see what I'm just doing? I'm gathering all the reasons why you're sick. And believe me, these are the reasons why you're sick. I want to know liver toxic burden. We live in an environment that is toxic, all the chemicals. everything you do, even the shampoos that you use, everything. The environment's full of toxins. Every person's body handles toxin overload differently. If you're sick and you have a worn-out body, your thyroid's not working right, you have an autoimmune condition or a disease, you have lupus or multiple sclerosis, we see all of this. That's a compromised body that usually has too much toxins inside. We want to get rid of that. So we'll detoxify your liver. We have a whole step-by-step process from the beginning to the end, how we get a person from ill health back towards optimal health. I want to know your brain function, your blood sugar balance, your gut. 70% of your immune system's here in your gut, digestive system. Okay, that's where I start. I start there almost always. Your thyroid function, your adrenal function, all the way down to your cellular level. Okay, if you're completely shot and worn out, that means your cells in your body are tired. The mitochondria, the powerhouse, the ATP, energy production is not working. We look there. We work at the cellular level, folks. Incredible stuff. So some of the products we will give you are nutrients to get rid of bad things in your gut and restore all the good things in your digestive system, like the good flora. This one here is for adrenal health. This is to balance your adrenals and allow you to sleep normally every night. pH balance. A lot of us, our pH inside our body is too acidic. That keeps you sick. We want it more alkaline. These are just samples. Trust me, this is just putting a few of the pieces together. It's extensive. I want you to know, Jen, who works with me, she's been here for over 10 years. We work side by side with great staff. What makes functional medicine practitioners different is we spend a tremendous amount of time with you face to face and behind the scenes, looking over all your test results. Okay, it's not a quick, here's a prescription, you're done. You know that doesn't work for this, you're sick. So each visit, we spend time with the person, make sure they're eating correctly, make sure they're following the protocol of what we need. The other thing I want to mention to you, let's talk about insurance. Some people will go, does insurance pay for all this? The answer is no, it doesn't. It will pay for possibly the blood test in some cases. Okay, it'll pay for blood tests in some cases, not all, but it may pay for some other testing, but typically in functional medicine practice, it will not cover very much. But we allow for that. We give large discounted fees over the course of the 3-month program that this usually will take. Took you years to get sick. I mean years to get sick. It's going to take at least 3 months on to get yourself better. We work at 3-month intervals. We will see you typically once a week if you live here. If you're flying in from out of state, we'll see you at that visit and then usually consult over the phone. But if you're here, we'll see you weekly. We'll keep you in a moving stream of health for 3 months and then evaluate you again and see what further care may or may not be needed at that time. So we covered a lot. Watch this video a couple of times so you can get it. I really said a lot in the last 20 minutes. If you have any questions, call us at 321-783-1960. Okay, Dr. Steve Alukonis. Thank you.